Hello, my name is Dimitrios Athanasiadis and I'm the Bariatric Research Fellow working with Indiana University. I wanted to thank SAGES for the opportunity to present the work of our team regarding our unique Facebook group and its effect on the social support of our bariatric patients. I have nothing to disclose. It's estimated that obesity will eventually affect 1 in 2 adults in the United States by 2030, and the most impactful and durable option for weight loss is bariatric surgery. However, for multiple reasons, outcomes vary widely among patients. One such factor is social support, which can affect weight loss, level of depression, and problematic eating behaviors following bariatric surgery. Sources of social support include family, friends, the surrounding community, and healthcare providers who provide follow-up visits and in-person group meetings. The importance of postoperative social support led the American Society of Metabolic and Bariatric Surgery, ASMBS, to mandate that accredited bariatric centers offer in-person social support groups to all postoperative patients. Unfortunately, there are many barriers that prevent patients from attending both the clinic follow-ups and the in-person social support meetings, such as impaired mobility and lack of transportation, long travel distances, and being too busy to attend them in person. As a result, online forums have been developed where patients can give advice to their peers on questions or concerns that arise during the pre- and post-operative period. Online groups are more convenient and accessible to all patients. However, despite the appeal and importance of the online social support groups, it's not clear whether their content is as accurate and helpful as the information being exchanged in the formal in-person social support meetings where healthcare providers are hosting. Moreover, the quality of support that these patients receive is variable depending on the group. Additionally, many of these web-based forums or groups may not convey accurate information and do not have healthcare professionals monitoring the questions and answers that the platform users give. That is why, in 2015, our program launched a private Facebook support group supervised by our personnel to provide free and easily accessible social support to our clinic's patients. This ensures they receive the benefits of an online social support group without its disadvantages. In the group, patients can ask their peers or the staff questions, create motivational posts, ask for advice, among others. It's important to mention that only our clinic's patients are allowed and are getting approved to the Facebook group by our MAs and dietitians. Additionally, all posts are being screened for any inappropriate content before getting approved. Lastly, we have more than 5 clinics personnel that are working as administrators in order to succeed, not having any delays in the posting. Thus, we aim to study the effectiveness of our Facebook social support group and whether it's beneficial for our patients. For the study, all Facebook group posts since its establishment in 2015 were reviewed and a thematic analysis was undertaken. Group members also completed a survey related to their Facebook group experience and its perceived value. Responses were collected using a 5-point Likert scale. In addition, 30 members were phone interviewed using open-ended questions and their responses were analyzed. In this figure, you can see the number of posts, reactions, shares, and comments for the 5 years that our group is active. Specifically, the posts increased more than 500% since creation and are keep rising. Specifically, our Facebook page has a bit more than 1,200 patients and about 1,200,000 posts with more than 100,000 comments and more than 200,000 likes, which leads to an average of 8 comments on each post. The survey we sent had a 20% response rate, as 246 patients devoted the time to answer it. To have a better understanding of our patient population, our respondents were 90% females with an average age of 45.2, and the majority had a private insurance. In addition, as you can see in the figure, more than 50% of the respondents checked the group's notifications daily or more frequently, such as whenever they got a notification or every couple of hours. In the thematic analysis of the posts, 10 common themes were identified. The most common category was seeking advice regarding surgery, diet, physical activity, or something else. Interestingly, we identified that post-operative patients were more likely to ask questions than the pre-operative ones. The rest of the categories can be found in this table, such as posts that give advice, or motivate, or give an update about the patient's status, or includes administrators' instructions, or there are posts about diet, about sharing failures, sharing their physical activity routine, entail humor, or something else. In addition to identifying the categories, we discovered that there were differences in the questions or the types of posts the patients were making, depending on whether they were in the preoperative or postoperative phase of their journey. Motivational posts were shared mostly by the postoperative patients, while sharing current status updates were more likely to be coming from the preoperative ones. In our survey, most patients agreed that the group provided useful information that significantly helped them do well postoperatively. They agreed that it provided them emotional support, while the successful posts did not cause them any anxiety. Finally, they felt connected with their peers, but did not feel that it helped them control their eating habits. The phone interviews unanimously suggested that the Facebook group was very useful. Specifically, the interviews revealed that the constant social support and the quick responses to their questions by both the healthcare professionals and their fellow patients were invaluable. Many referred to the group as their sole source of social support, as they live too far away from the clinic or do not have time to attend the support meetings. The majority of patients described the Facebook as uplifting, and that it motivates them to continue as they have incentives to do better, and that I am not alone, as many are going through the same struggles. Patients during the interviews revealed that their most loved posts were the motivational success posts, the one that shared healthy recipes, and the do's and don'ts from the healthcare professionals. Lastly, most respondents stated that both writing and reading posts were equally important, as quote, some of us do not feel comfortable sharing personal experiences, but love reading posts and providing answers whenever we can. We only interviewed 2 participants who had some concerns about the group. They specifically didn't like the negativity of some individuals in the group. They did not like that family members are not allowed in the group and that some posts were not getting approved because they were deemed medical. However, they understood the reason we did that. In conclusion, Facebook groups can provide effective social support for patients before and after bariatric surgery. Peers educate, answer questions, and motivate other patients by sharing their positive experiences. However, it's important to monitor posts to ensure accuracy and quality of feedback. Regarding future goals, we aim to study whether patients with higher activity in the Facebook group have better postoperative outcomes. Thank you very much, and I'm happy to take any questions.